All right, folks, we are at about 90 participants. We have a few more to go, but we'll go ahead and get started. And then if you have any questions, just let us know, but let's kick this off. So good morning. Thank you so much for taking the time to be a part of this webinar today. We're happy to have participation from both County Counsel and the Department of Public Health. The purpose of this webinar will be to provide additional clarity and guidance to some of the various sections of the current public health orders in place. This sector is especially special today. We do have a new public health order coming out, and we will be addressing some of the revisions to your industry during today's webinar. So please keep in mind, and just that will be coming out shortly, hopefully as this presentation is happening. To start, my name is Lauren Cartwright. I'm the Business Retention and Expansion Program Manager with the Sonoma County Economic Development Board. I will be the moderator for today's session. This morning, we are joined by Sheba Person-Whitley, the Executive Director for the Economic Development Board, Dr. Sundari Mase, Public Health Officer for the County of Sonoma, Jennifer Klein, Chief Deputy County Counsel for the County of Sonoma. Please note that during this session, we will also have a Spanish translation channel available. Please navigate to the bottom of your screen to listen in this format. We are also recording each webinar and will post publicly in the coming days. Today's presentation is going to begin with a brief overview of the current situation of COVID-19 in Sonoma County with Dr. Mase, followed by a detailed interpretation from Jennifer of the various health orders that will now be in place for Sonoma County for the construction and trades industry. We ask that you please save your questions until the end of the presentation. We will then open it up for a live Q&A session with our various webinar hosts. Due to the interest in this industry, as well as the amount of attendees today, we will be adding on to the webinar by 15 minutes. So if you're able to stick with us until about 12:15 p.m., we will stay online for extra questions. In the case that we're not able to answer all the questions, even with the extra time today, we will work with our panelists to retrieve the necessary information, and we'll follow up with the entire group after the event to provide any additional clarity that's needed. Without further ado, let's go ahead and get started. I will share my screen with you, and Dr. Mase will start the presentation.
Hey, good morning, everyone. I'm glad to have you all on the line. I'm sure there's going to be plenty of questions. What I want to do is give an overview of the coronavirus situation first to put things in perspective. Next slide, please. So we will review the public health. Oh, I'm sorry. You already went through that. That's fine. So let's go through our cases. Is this online? Like we can go, okay, perfect.
Yeah.
All right, thank you so much. As of today, and we probably haven't updated our scoreboard quite yet, but we have 244 total cases, and I believe we're up about 12 or 13 cases from yesterday. We have 128 recovered cases, 114 active cases, and the 2 deaths that we have reported all along. Why don't we go to the World, USA, California tab? Perfect. Mm-hmm. So to put this in perspective, you can see that globally now there's 3.3 million cases. In fact, 85,000 approximately cases in the last 24 hours. It seems like we've been adding about 3% of cases, whether it be worldwide, USA, or California, every 24 hours for a while. Can you go to the deaths worldwide? Do I have control of the screen actually, Lauren, or no? Okay. All right. So if we can go to the deaths, which is at the bottom of the worldwide green.
Is that right?
Actually, yeah, we can just go back. It's okay. To the World, USA, California screen. Great. Okay. Oops, things are very small. Okay, right. So you can see the US now has over 1 million cases. So we actually have 1/3 of the cases in the world. And we are the country that has the most cases as a result. And it's partly because obviously we're a very big country with a very big population, but compared to Europe, but we do have a disproportionate number, and largely I think because we have put in a lot of mitigation measures, but we had a lot of community transmission even before those measures were put in place. Here in California, we have 50,000 cases, and Why don't we go back to the Sonoma County screen? And can you open up the tab that says Bay Area County Cases?
Yes.
You might ask how we're doing respective to other counties in the Bay Area. As you can see, Santa Clara has over 2,000 cases, 2,100, and it's followed by Alameda, and then San Francisco with 1,500 cases or so. San Mateo has nearly 1,200. Contra Costa, 890. Marin's ahead of us just a little bit. Actually, you know, it looks like Marin's actually equal with us at 237. Solano and Sonoma are also very close to one another. So why does it look this way? Well, lots of reasons. First of all, the big international airports are in San Jose and in San Francisco. And there's also a lot more people coming and going. It's a more urban area. And so I think there's a lot more transmission initially in those areas than in our county. The other key factor that our modeling has also shown is that we put our shelter in place into effect when we only had a handful of cases. And that made a very, very big difference in interrupting transmission in the community in Sonoma. So we've been able to tamp down community transmission. The majority of our cases in the last 3 weeks have occurred in contacts to cases that have already been diagnosed, which is a very good thing. It means we know where they got COVID from, and we're the ones who have been targeting those contacts to test them. So we don't have cases popping up in the community very often now where we don't know where it came from, and that's called community transmission. Okay, let's go on to the next slide, please. Great. So that just kind of gives you an overview, and you can go on to socoemergency.org and you can go through all the screens and see more of the details about our cases, the percentage hospitalized, and other demographics as when you have time. So here are basically the key provisions of the shelter-in-place order are that people should stay at home, only leave the residence for essential activities, essential governmental functions, to work for essential businesses, or to perform minimum basic operations for non-essential businesses. The homeless folks are exempt, but are encouraged to seek shelter, and we are in fact trying to provide shelter for them in a non-congregate setting. There shall be no gatherings unless authorized by the order. And I think the one thing we have allowed is funerals of less than 10 persons because we realize that that's very essential. No travel unless authorized by the order as well. And there's very key terms that are defined in the order: social distancing and hygiene requirements, minimum basic operations, essential activities, travel, and businesses. And I'm sure you've seen a lot of this. Next slide, please. Right, so do we have the background coronavirus slides?
We do not have those today.
Okay, so is this something that we should have Jennifer go into then?
Yeah, I think we can have Jennifer segue, and then we'll see if any additional questions with regards to the virus or kind of the order come in towards the end, and we can just kind of tag team for
that. Sounds great. Okay, so I'm going to stop there and listen to Jennifer.
Thank you, Dr. Mase. All right, Jennifer, take it away. Thank you so much, Jennifer. If you want to go ahead and unmute, we can get you started.
All right, very good. Hello, everyone. I'm Jennifer Klein, Chief Deputy County Counsel. First, I apologize. The timing of your webinar is falling at kind of an unusual spot because the updated order hasn't
Hey, Jennifer?
Yes?
Can you speak up a little bit? I couldn't hear you for a second.
Sure.
Okay.
Can you hear me now?
Yes, thank you.
Okay. Can you see me okay?
Yeah.
So the timing of this webinar is a little bit unusual because the latest order has not been issued formally, but we generally know what the content of that is going to be, and so that is what I'm going to cover today, specifically for your industry. Some of these slides were based on the prior order, so the citations you're seeing here on this slide to Section 13F for the definition of essential business, some of those citations may be different for the new order. It looks like I tried to update it for some of the other sections. So just go ahead and look to the order when it ultimately comes out if you're looking for the specific section, and we can help direct you to that if that's needed, when that comes out. So essential businesses are defined in the order, and they, in general, have to maximize the number of people who work from home. Obviously, for your industry, that's not very possible. So we're looking at kind of relying heavily on the social distancing protocol that is also required of every essential business. The new order that's coming out will augment those requirements for the construction industry by including what we are calling a construction field safety requirements. And those are a detailed list in an appendix, and we'll go over that in this presentation. And the idea is that you'll take those field safety requirements and use them to inform and incorporate how you develop your social distancing protocol so that you can operate as an essential business. And of course, we're all learning here, and sometimes the reality of some of these requirements ends up being different when they're in practice. So the health officer, in collaboration with EDB and industry representatives, we're going to continue looking at best practices and where those guidelines and requirements can be improved. So please keep that in mind, that it's a changing situation. We're trying to do our best here. Next slide. So again, this is looking forward to the new order. This is what you can expect, that the definition of what is allowed construction is being expanded. So now businesses providing construction services in compliance with that construction field safety requirements that I alluded to are considered essential businesses. Next slide, please. So what does construction services mean? It means building, expanding, maintaining, operating, repairing, replacing, remodeling, retrofitting, refurbishing, a very broad concept to the exterior of any structure, the interior of any occupied structure, or any totally brand new structure. And it includes all services needed to support that activity. So again, a quick overview, that's any new development. The assumption is new development is not occupied by anyone until it's done. For an occupied structure, the exterior, painting, siding, things like that. And for the interior, it's going to be more limited if somebody's living there, and we'll get to that. Next slide. Examples of services needed to support construction activity: environmental review work, land surveying, plumbing, electrical, roofing, drywall, painting, fencing, paving, fixtures installation, and any inspection and similar types of services. Next slide. So what do we mean when we say an unoccupied structure? This is a new or existing structure that no person inhabits or accesses for the duration of the construction activity, except for the people actually performing the construction or construction support related work. Next slide. So what can be done for an occupied structure? Again, to an occupied structure, it's exterior work, landscaping, fencing, paving, and construction that's necessary to ensure that a structure is safe, sanitary, or habitable when in strict compliance with those construction field safety requirements at Appendix B. And that is the concept that exists currently, that construction work is allowed to make a structure safe, sanitary, or habitable. So that's in the current order, and it's being brought forward when the work is needed to the interior of an occupied structure. Next slide. Note, all allowed repair or construction in an occupied structure to make it safe, sanitary, or habitable has a couple more requirements. That work can't be reasonably delayed, that it truly is an immediate safety, sanitary, or habitability issue. Have to comply with all applicable codes, like building, fire, plumbing, etc. And it may not involve expansion of a structure. Adding on a room is not a safety, sanitation, or habitability problem. Next slide. So about additions, the general rule is that you cannot expand an occupied structure. There's an exception that we're, through an interpretation of the language I'm expecting, which is an addition will be allowed if it's completely sealed off from the existing occupied structure during construction. And that means including HVAC, we don't want any airflow between the occupied structure and the addition that's under construction. We want some sort of solid barrier that's preventing people from commingling, workers and occupants. At all times, we want to keep that separate. The philosophy behind this exception is that by creating such a significant barrier, you're basically working on the exterior of the structure. And so that's why it's allowed. Next slide. What work is considered necessary for safety, sanitation, or habitability of a structure? So this is when you would be allowed to work inside an occupied structure. And the order gives a list of 10 examples. And these examples are generally taken from state laws sort of for tenable dwellings. And they're very similar to what other counties are using. So I don't think any of this will surprise people, but there was really a desire for us to define what we meant when we said safety, sanitation, habitability. So one, provision of working bathrooms, provision of operable kitchens, heating and ventilation system work necessary to maintain operable systems, electrical work to supply electricity and make it safe. Next slide. Plumbing work needed for bathrooms or kitchens to correct any hazardous plumbing conditions. Any painting that's needed to address any mildew or mold or dampness issues. If you have a vermin problem that's destroyed something, you can address that. Something that's addressing damage that's even smoke damage that is really causing a health issue. Similarly, if carpet or flooring needs to be replaced because there's been some sort of damage from water or mold or vermin, that can also be addressed. Work needed to repair weather protection. If you've got a leaking roof or siding that's not intact and causing problems there, all of these things, including broken windows and doors, we want an intact structure for safety. Other repair work to fix or damage or address any other health hazards, vector control, and other life safety work. And obviously any construction that's needed to ensure access for persons with disabilities or physical limitations, like ramps and things like that, they're also going to be permitted while it's an occupied structure. So that's the list of things that we consider, and it's an example list. There may be other things, but that gives you an idea of what's safety, sanitation, and habitability related. So in addition, we have, we are now focused on protective measures. Now that so many more construction workers and those trades are going to be out working, we want to really focus on what's an appropriate social distancing protocol. And again, to give even more guidance to this industry, we've come up with a list of field safety requirements. These are a blending of requirements from San Francisco County and Napa County. We tried to take kind of the most reasonable and best of both of them. And my understanding is that the San Francisco list was developed in cooperation with industry. So hopefully it is nothing that seems, out from left field for you all. So the idea is that the Appendix B field safety requirements, you review those and incorporate them into your social distancing protocol, which all essential businesses must develop and post and provide to all employees and to law enforcement on request. So that is sort of your, I am an essential business, here is my plan for staying safe. And we'll get into a little bit more of those details next. Again, it's required, the social distancing protocol is required of every essential business. You have to prepare and post it, give it to your employees, provide on demand to law enforcement. I've already gone over this. Next slide. Here's just a little snip of what that Appendix A looks like if you haven't looked at it yet. I believe on the website that this is a Word document that you fill in, and it's the link under the link to the order. As the new order is issued, I'm not sure how the links may change, but look for this Appendix A, which is a fillable document. Next slide. Appendix B, the construction field safety requirements, lists a variety of elements for businesses in your industry. Next slide. There are two parts to Appendix B. One are the employer-focused elements, and the last part is the employee-focused elements, and we call that the code of safety conduct that the employer puts out for its employees. Next slide. So looking first to the employer-focused requirements, a screening protocol to stop infected staff from entering the workplace, and that may involve, and again, some of this is still being worked on, but this may involve taking people's temperatures, a questionnaire, is anyone sick in your household, things like that. You'll want an assembly point at the start of every workday where everyone can be at least 6 feet apart. We can use that assembly at the beginning of the day to educate everyone on just sort of reminders about safety practices. Daily tailgate to review the protocols and have attendance taken and have everyone sign off so that they were there, they heard what they needed to hear. That's an important measure. Next. You'll need to designate a site safety rep to monitor and implement the COVID-19 safety practices in your protocol. So supervisors need authority to halt all activities that don't adhere to the safety practices. So having that chain of command is going to be really important, and you're going to want to back up. And so assign a second safety officer to the construction site to ensure protocols are being followed. Next. So some large sites will have a variety of contractors and subcontractors, likely at the same time even. So there'll need to be coordination among all of those employers. So share your social distancing protocols, and to the extent people are going into the space of another, the more stringent of your social distancing protocols is what people will need to follow. So hopefully everyone is on, pretty much on the same page, and these protocols are not varying dramatically. But you'll definitely want to communicate with the different folks on the job to the extent there are different social distancing protocols. Another option is to ensure that the trades are staggered so that you don't have a lot of people overlapping at the same time. And of course, the more you can reduce the density of the people at the work site, then the ability to maintain social distancing 6 feet apart will be much easier. So just in general, you want to minimize interactions with each other, and that goes for anyone visiting the site to deliver materials or equipment as well, or other subcontractors. Next. You'll want to identify choke points or high-risk areas where people are likely to come into close contact. We recognize that it's not possible necessarily to stay 6 feet away at all times. So think about when you're most likely to not be able to stay 6 feet apart, and take appropriate steps to maintain sanitation and facial coverings and other things that can mitigate spread of the virus. Very important, all businesses, I'm sure you've even noticed that your grocery store's hours have been modified. It's to allow extra time for cleaning, and this industry will be no different. You'll want to establish a cleaning and decontamination protocols, and then create time to follow them. You'll want to establish and maintain hand washing stations, sufficiently close to people to where they will actually use them, and make sure they're stocked with supplies. Next. Ensure all persons utilize personal protective equipment, including facial coverings. or if the job requires an N95 because of the nature of the chemicals or whatever is being picked up, they need to be protected for the type of job, then whatever is appropriate. Lastly, you're going to want to establish a code of safety practices that will at a minimum require staff to follow certain practices I'll go over in a minute during the course of their work. And these are the employee-focused requirements. Next. Again, kind of goes without saying, but if you feel sick or have been exposed to anyone who is sick with COVID-19, stay home. You may be required to provide test results showing a negative result that you're not infected with COVID-19 before being allowed to return to work. Wash hands frequently for at least 20 seconds with soap and water. Avoid touching your face with unsanitized hands. Avoid touching shared surfaces as well. You can. Next. Constantly observe your work distances. I think over time, our entire community is going to, be able to eyeball 6 feet. Try to observe where you are in relation to other people and keep apart to the extent you can to get the job done. Maintain that separation at all times. Don't shake hands. Don't make other unnecessary contact with other staff. Next. Don't carpool with people that you are not sharing your household with. Don't share phones. Use of microwaves, water coolers, and other type of group equipment for breaks should be suspended until further notice. Clean and disinfect personal tools prior to use, and as well as group tools. I think it's actually fairly common for people to have their own tools, so maybe just make it very clear whose tools are whose, and make sure that the cleaning practices are in place just as a precaution. Next. More on the code of safety practices for employees. Any disposable paper towels and similar waste deposited in no-touch waste bins. Don't cough or sneeze into your hand. Follow the established CDC guidelines into your elbow or things like that. And obviously, if you do cough into your hand, please wash it for 20 seconds with soap and water, or use a hand sanitizer that's recommended by the CDC. Workers should change their work clothes and shoes prior to arriving home. Don't shake out your clothes and launder separately from other laundry. We want to really kind of have these decontamination processes taken, all the way through, so that people don't kind of lose sight of the need for safety just because, it's the end of the day, end of the workday. Next. So looking ahead, like I alluded to earlier, the public health officer, in consultation with construction industry representatives and the Economic Development Board, may identify and establish additional best practices. Your feedback is encouraged. So to the extent this can really reflect how the construction industry really works, and how to fashion protective measures that are effective. That's our goal, and we want to have a cooperative process. Next. So some frequently asked questions. Are arborists, tree trimmers, landscapers, and gardeners permitted to operate under the order? So this is looking ahead to the new order, and that is a yes. All outdoor services like arborists, landscapers, gardeners, they are allowed as essential businesses. There's no need to prove that what you're doing is for a health or safety reason. Is cleanup and remediation of a parcel burned in the wildfires allowed under the health order? Yes, that was allowed under the old order, and under the expected new order, it will also be allowed. We've expressly called out environmental remediation work under the new order. Are fire rebuilds still allowed? Yes, construction of all new buildings for residential or commercial purposes is allowed. It doesn't matter that it's a fire rebuild right now. It doesn't matter if it's got an affordable housing component. It doesn't matter if it's mixed use. It's all allowed if it's new. I'm a biologist. Can I conduct field work to support an environmental review document necessary for a construction project? Yes, environmental review work to support construction projects, including field work by biologists, archaeologists, geologists, hydrologists, traffic engineers. All of that work is outdoor work, and it all supports construction work. And that would include any monitoring that you have during construction. So both the pre-construction review work and any monitoring that you have as a condition of approval is going to fall under this section. Are inspections for installation of solar arrays and solar batteries for residents allowed? Yes, inspections for installation of solar arrays, solar batteries, they are allowed under the order. They, to the extent the work is part of the utilities provision of electricity, it's going to fall under essential infrastructure work. And obviously any work to the exterior of a home is fine. Next. Does the order allow construction that expands telecommunication, electrical, or food production facilities? Yes. Under the expected new order, construction and expansion of telecommunication, electrical, utilities, food production, and other identified categories of essential infrastructure are allowed. All businesses performing that type of construction have to also comply with the special field safety guidelines for construction and have a social distancing protocol. So these categories are not under essential business, they're under essential infrastructure. So it's a little bit different. Next.
Okay.
Q&A. How are we on time?
We're good. We've got 40
minutes
minutes and we already have at least 8 questions. So let's go ahead and queue it up. I will stop sharing my screen. We'll bring everyone back. Thank you all so much for listening and tuning in. We'll try and get to all the questions we can. So I'm going to go from the top from the Q&A panel. First question is, when will the new shelter in place for construction be made public?
I expect it will be today.
Okay. Do we know if there's a certain time
maybe
today,
tomorrow.
Dr. Mase? Or I don't know if you have any information.
Very, very, very soon.
Okay, great. Another question is, Appendix B available in Spanish?
I believe the entire order will be translated, including the appendices.
Okay, fantastic. And then Peggy, I think that answers, she asked about Appendix A as well, so great.
It takes a little while to translate it, which may be why if it doesn't go out today, they're getting the documents remediated for accessibility online and translated. That takes a little bit of time. We're also trying to get all the FAQs online at the same time. So yeah,
great.
This is a little bit of a preview of what's coming, but we'll have more accessible information when it's all official.
Okay, great. I got a question about, can we get a copy of the slides? Yes, as soon as we download the webinar video, we're going to add in some Spanish closed captioning. We will send out a copy of the presentation and the slides for everyone as well. And we will post these on the EDB website too.
And just, as a caveat, to the extent anything I've said, to the extent the order changes between the time we finish this webinar and it's officially out, the language of the order will control. I don't expect any of these things that I've said to change, but in case they, you should always consult the final order to be sure.
And then we had a question for, what appendices are needed for owner builder permits? I'm not sure for the question, Jay, you asked that. Could you try and type in another question? Maybe
I think I understand. I think I understand. So somebody owns the property, they're building the structure, and what do they have to follow the appendix, the appendices? And I think that, unless you're a completely solo operation and you don't need anybody to do anything to help you with your build, then yes, you need to follow the safety protocols and develop that for your project.
Okay, great. All right, the next one. If I am a general contractor with no crew, can I do work in occupied homes where there's no interaction or contact with the homeowner?
Could you repeat that?
If I'm a general contractor with no crew, can I do work in an occupied home where there is no interaction or contact with the homeowner?
No, if you are an essential business, you are required to have a social distancing protocol. You are required to have the construction field safety guidelines incorporated into that. There may be components of that that don't necessarily apply if they apply, if they're for you interacting with your other workers and you don't have any, but you still need to, for your own safety, comply with the minimum requirements. So you have to have a social distancing protocol, Appendix A. You must also incorporate Appendix B into it, or you are not in compliance and you cannot operate as an essential business. So that message must be very clearly communicated. If you are doing, that is required of all essential businesses. So before you do any of the work. So then the second part of that question is, can I do work in an occupied structure? The answer is no, unless it is for the health, safety, and habitability reasons that were listed, period. So if someone wants a purely cosmetic kitchen remodel, they must move out of their house while that happens.
Thank you. Okay, here's one. All right. I have a 3-story hotel. We have a renovation project to mainly upgrade all of the furniture, fixtures, and equipment in every one of our 100 guest rooms and other areas. The work is all interior to the hotel. After a year of planning and furniture acquisition, we are ready to start July 1st. The hotel is occupied at a low level, around 20%, but we will do the renovation one floor at a time, fully walling off the area being worked on. This is a $4 million project and is important to maintain the safety and quality of the hotel. Can we proceed?
I think I've already provided as much information as I can provide. This would essentially be the expanding the work. So if it's the equivalent of working in an unoccupied structure or the equivalent of working on the exterior, then it can be allowed as an addition. I think in general, what's being proposed here would be very, very difficult to allow with an occupied building. So I think as things start to become unoccupied, there's going to need to be some planning there and coordination so that structure is not occupied when that work happens. So I think I actually can't answer that question without sort of knowing more, but that's not something that we've contemplated, that work interior to an occupied structure would be allowed if it could be walled off. So I think that's probably okay, but for such a big structure, the effectiveness of that walling off, I can't know.
Yeah. Dr. Mase, are you still on the line? Do you have any insight you could share with this question? I'm happy to reread it by perhaps. Okay, we'll see if we can get her in the next one.
I think without knowing more, if you follow the guidelines for as though it were an addition, given the scale, but I'm having a hard time imagining how you could actually stop airflow and interaction between. That just seems very difficult to me.
Absolutely. And then I encourage anyone, as we're going through these questions, if you have any other new questions, please feel free to email us. I'll put the email in the webinar chat. It's just EDB event, and we can work with County Counsel to try and get further clarification or information as well. I know we have 25 more questions lined up, so we definitely want to try and make through the list today. Okay, I guess this is another one. Also, many hotels are renovated while operating, so we are very well experienced with walling off the areas being worked on. We will follow all protocols required by the county. So I think this
is a question we're going to have to get back to people on. This is not something that we contemplated when coming up with the order or FAQs. I mean, as it's written now, interior work to occupied structures is not permitted unless it's for a health or safety reason, and upgrading a hotel is not a health or safety reason. So that's the answer for right now, but we can look into, whether there can be, some flexibility in that area. But right now the answer is no.
We can definitely follow up, like I said, for everyone who's attending today. Thank you, Jennifer. Okay. Another question about when the shelter in place order will be released. We need time to react to this before this coming Monday when the other order is no longer in effect.
Right. So my understanding is the new order will take effect, I think it's 2 minutes after the expiration of the old order. So there'll be 2 minutes where we're all under the state's order. But yeah, there'll be a complete transition. The old order stops and new order starts.
Yeah, and then we'll follow up as well. I'm certain that it was going to be coming out today. I believe that was the last that we heard. It was just a matter of course, translations like Jennifer said. So we'll see if we can get Dr. Mase back on the line to try and answer these questions as well about the timing of that new order.
What I have is 12:01 on May 4th.
Okay.
That's
Okay,
what
so that answers your question to start. Okay. I think we'll follow on that one. Okay. Can exterior work proceed if portions require workers to enter an occupied home?
No.
Okay.
Unless it's for health or safety or habitability reasons,
Okay.
like replacing a window that's broken.
All right. With that one, let me see. So another question about the shelter in place taking into effect. So as I mentioned before, we'll make sure that all the slides are available. It does take some time to do some closed captioning. So what I can do is we can send out the final presentation to all the participants and attendees today. And then we'll send a follow-up email in the coming days. We have all the closed captioning done and the video uploaded to YouTube. So you can at least get the slides to refer to in advance of Monday. And then these documents, so the videos will live on YouTube. We will also upload them to the Economic Development Board website. We'll make sure we include a link today and we send out the copy of the PowerPoint as well. Another question about where to find the information. Okay. Is architectural support included as essential support of construction?
Yes.
Yes. Will the order be similar to the other 6 Bay Area counties? If so, will there be a JSAS on large projects?
I don't know what JSAS means.
Either. I think we might have to follow up on that question,
Yeah.
John, if that's okay.
We also need to take a look at the orders from the other counties. So
Exactly. But as Jennifer mentioned, she did incorporate San Francisco and Napa, correct?
Right. Right.
So
But they,
we did most
to
of
the
those.
extent they're changing as well, it's everything is, being modified. So
We
we're
call it
doing
the
the best we
evolving
can.
situation. Okay. If an employee becomes ill and could possibly have COVID-19, what must we require for them in order to allow them to return to work? I don't know, that'd be more of a question. Dr. Mase, did we get back to you by chance? Are you on the line? Perhaps not. Okay, I think we'll have to follow up with that question, but I think that's more of a Dr. Mase question for sure. Will there be a requirement for a third-party job site safety accountability supervisor?
That's not part of the Appendix B, that it be a third party. That's in the discretion of the company.
Okay, great. To clarify, is commercial construction allowed only for essential businesses?
No. No, all commercial and all new commercial and residential construction, assuming those are unoccupied buildings being built, is allowed. You don't have to be building an essential business.
Okay. And let me see the next one. How do we communicate with the public health department on improving best practices?
I think perhaps you could answer that question. My understanding is that EDB is sort of facilitating task forces to work with industry to develop some best practices, and that there'll be cooperation with the health department. But perhaps EDB can answer that better than I can.
Yeah, I know Sheba had to step away, but we are working on a recovery task force right now. What I would suggest for the time being is if you want to forward any questions or any feedback to edbevents@sonoma-county.org, I'll add the email address to the webinar chat right now. Please feel free to share that, and we can make sure we get that to the right channels. We're working closely with County Counsel as well, so we can make sure everyone kind of sees that feedback. And as Jennifer mentioned, we definitely want to understand or kind of know what you guys are trying to execute, how you're trying to incorporate all these rules into your workplace, just so we can, moving forward, try to understand what you're doing and how we can help you, through the different phases of reopening. Okay. Let's see, more questions about when the new revised shelter in place will be released. Here's a great one. Will the police department be responsible for compliance? If not, who is responsible?
Same as under the prior orders, law enforcement enforces the shelter-in-place order. So if you're in the city, that will be city police. Unincorporated would be the sheriff. There may be some expansion of who is authorized to enforce the order under the new language. I can't remember, but yes, the law enforcement has always been authorized to enforce violations of the order.
Great. If you are subcontracting out to all trades, are you still required to have tailgate meetings with all workers on a daily basis?
I think that you can build that into your social distancing protocol and your Appendix B. I mean, if it's required and there's no one to tailgate with, then again, you're gonna have to coordinate with all the different subcontractors who are all gonna each have their own social distancing plan that incorporates Appendix B. So everyone needs to communicate what that plan is and follow the most stringent of all the plans when everyone is together at the job site. So you should have your own plan in order to fill in any gaps that are out there that may exist for these subcontractors. But hopefully everyone's plans will be comprehensive and very similar. But there's no sort of path to rely on someone else's plan. If you're an essential business, you need your own plan.
Here's a good question as well. Will construction workers be given priority for testing if they are suspected of being infected?
I don't have the answer to that right now. I think that based on testing supplies, that's kind of a continually, that question's frequently being asked and revised. The answer to it is revised based on a variety of factors. And it's really a question for Dr. Mase. And if she's not going to, she may join us in a few more minutes. I think she got pulled away, but yeah.
Again, for all attendees, if we aren't able to provide a full answer to your question, we need to save it for later. As we did with our other webinars, we found answers after the fact and sent them out to the entire group of attendees. So we'll make sure to make a list and kind of fill it in as we can with Dr. Mase and County Counsel. Let's see. A lot of exterior projects also require some entry into the interior of a home. For example, solar or some roof repairs. Is that allowed?
So if a roof repair is allowed because it's a health, safety, or relation to habitation having an intact structure, then it would be allowed. Solar installations are part of essential infrastructure and they are allowed, even if it's an occupied dwelling. But in general, if you're doing exterior work and it's not also overlapping with an essential infrastructure component for a utility or overlapping with a health, safety, sanitation, habitability need, then that work needs to be deferred until the order is lifted.
Okay.
Or the people need to move out.
Yeah. Okay, 15 more to go. We have still some good time, so we're trying to get through them as best we can. The next one, are all professional services associated with construction, for example, engineers and architects, now considered essential businesses?
Yes, we are broadly viewing construction support services. It would include engineers and architects.
Okay. Okay. Let me see, where is that?
To the extent those people are working in offices, they'll need a social distancing protocol that covers their office work, and also when they're on the job, they'll need the construction field safety guidelines incorporated into their protocols as well.
Okay. And then, so for the gentleman who was asking about the 3-story hotel project, we have a couple more questions from him. He's asking if there's anyone, say for example, you have a project like this, is there anyone they can talk to about air barriers or like building the walls, or how they can kind of explain their project in further detail? Just because I know
I think we'll just have to follow up. That seems like a fairly unique situation. I mean, the general rule under the order is no expansion of buildings that are occupied, period. We're trying to be accommodating by recognizing that there may be scenarios where you can have by building barriers, you can make it the equivalent of exterior work or the equivalent of just a new unoccupied structure. To the extent that's really not possible, and perhaps the tradespeople know best if that's really possible or not. If it's not possible, then you're not going to be able to do it. If it's possible and can be done effectively, then it can be allowed. So I think those conversations do need to happen, and some best practices, probably need to be further developed, but we just don't have all the answers right now.
Yeah, we can definitely follow up with you on that one. We understand the importance of that project and definitely want to
it's a
try and
big,
get
yeah,
the
I
answers we
understand.
can.
And I understand it's frustrating because a new hotel ground up with no occupants would be allowed. So, but we're really trying to, minimize interaction with the public here.
Absolutely. Okay, let's see. There's a question about, is there a template plan? I think that they're referring to the social distancing protocol, and I think that you were highlighting Appendix A. And
There is a template for Appendix A, and then Appendix B lists the requirements to incorporate into that. We want to give some flexibility on how that's developed, but there is a list in Appendix B of what you incorporate into Appendix A if you are a construction or construction support business. So some of it's just going to have to be, everyone's kind of figuring this out on their own, but do the best you can.
Okay. Are construction workers required to wear cloth masks like the public social distancing protocol while working?
Yes, unless the job requires something more protective.
All right, let me see. We got quite a few coming in. Okay, so that one we already answered. We have a question about if we can share the URL with the live COVID tracking data. I will find that and I will put that in the chat box as well in just a couple minutes. Let's see. Are there any performance standards for air barriers?
I don't know.
We will have to look that one up after this, if that's okay, Mr. J. Let's see. Are suppliers of construction materials now considered essential businesses?
I think hardware stores have always been considered essential businesses. So yes, I mean, to the extent you need pavers and wood and things like that for your project, then yes, those businesses are considered essential, and they'll need to have their social distancing protocols in place as well.
Okay.
And they may, depending on deliveries and shipping and things like that, there may need to be some extra precautions in place.
Okay. Another question: are workers required to bring their lunch from home?
No. If the order doesn't address that, so. Yeah. There's no requirement that people bring their lunch from home, but you don't want to be sharing lunch with other people. So that's, I think, up for the business to, if they want to include that in their plan, they can. It's not required, other than, don't share water bottles and microwaves. Don't be touching, shared things.
Okay. And I saw another, okay. Who are the local industry resources you have used to develop the elements of your order? None of the major construction associations locally were consulted, as far as we know.
Right, because we wanted to open up as fast as possible, we didn't have time to kind of go through that process. So we borrowed from San Francisco, and my understanding is that the Bay Area counties went through that process, and that's what we used was the result of that, in addition to some guidelines that Napa County had as well. So if they don't look like they were done in consultation with industry, then there's not much I can say about that. But that's my understanding, is that they were, and that we wanted to open things up as fast as possible, and that kind of process would have slowed things down. So that's why you have what you have, and to the extent we need to refine it or amend it, that is always an option going forward. And the collaborative process that EDB is starting now to come up with some best practices with local industry, that's the opportunity to provide that feedback and that refinement. So these things are not necessarily locked in stone, but if you want to start right now, this is what you have to work with.
Exactly. And like just Jennifer said, as we go through this process, please feel free to use the email address in the, that sent you your registration, or feel free to use the email address I included in the chat and send us any suggestions you have on guidelines your organizations are using, just so as we get through this process, we can kind of work with you and better understand how we can reopen and also protect everyone at the same time. Okay, I'm gonna take a break from the Q&A because I've seen a few questions coming through the chat itself. So let's see. Okay. Okay, the URL that we sent already, a link for the slide deck I addressed. Dr. Mase said she'll be back at noon to answer questions. Okay. Are we allowed to visit houses to discuss with homeowners a new project that will meet the essential construction business criteria as long as we observe the social distancing protocol?
Oh, it's a good question. I think I'll think
Good
about
question.
that. I mean, all essential businesses are to do work virtually if at all possible. So I think, there may need to be a phone consultation, and if it sounds from the phone consultation that it's a public safety, sanitation, or habitability issue, then, based on that, I think you can go and check out the work and give an estimate. But if based on a phone or video conference that it seems like it's an elective, cosmetic, something that can be reasonably deferred, you'll need to not do that or get more information. So all essential businesses have to work virtually to the extent possible. So I think that would fall into that, do your homework before you go to an occupied structure and start interacting.
Okay. Another great question. Under the new law, can we get penalized by any contract that's expiring? How is all of this being applied?
Can you repeat the question?
Under the new law, can we get penalized by any contract expiring? How is all of this being applied?
I don't understand the question.
Could you, I don't have the full name, but if you submitted that question, that was at around 11:53. Could you resubmit with some more detail? If you want to add it to the Q&A function, we can check that one as well. Or let's see. Yeah, if you want to try and just rephrase that, we can definitely try to answer that. We have about 16 minutes left. Okay, let's see. 1 second. Is the reconfiguration of furniture within the office to maintain social distancing allowed?
Yes. In fact, encouraged.
Okay, let's see.
I assume that's inside your own office, your own construction business office, and that you're not going into other people's businesses to move their furniture around. So
Yeah, I think that's a great question, actually. One thing I'd written down was just about office buildings and kind of any construction involved with that, if you have any guidelines or if that's considered essential or if it's in that sanitation kind of category you mentioned.
right.
As an essential business that has an office showroom, may we be open for the public to come into our office showroom if we maintain social distancing requirements?
An office showroom like a model home or something like that. I would say, let's think about that. Without any further guidance on that, I would look to the real estate guidelines in the new order, which only allow for viewing an occupied home if certain precautions are taken and certain criteria are met. So, I would not want to see a bunch of people in that showroom, even if they are social distancing. So especially if that can all be done, virtually. But go ahead and submit that question and we'll see if there's a better answer.
Absolutely. And then we have another question. Marin County's health order prohibits the use of medical grade PPE. Is that the case for Sonoma County? We have leftover N95 masks from the fires. Can we use them?
The facial covering order encourages fabric is all that's needed to meet the requirements of that. So there's no prohibition on using N95 masks. And I understand in the construction trade, sometimes that's needed for just the safety of the worker. So there's no prohibition on it.
Okay. And then we got a description of what the JSAS was. So will the order be similar to the other 6 Bay Area counties? If so, will there be a, 1 second, job site safety accountability supervisor who appoints required? Like, is that a required position within construction?
I'd have to see what the other counties say, but in our Appendix B, you're required to have a site safety rep. Ours is an SSR. So perhaps these are similar roles with different titles. But that person, you need to have someone who's monitoring the activity and that, is ensuring that the protocols are being followed, and that somebody, either that person or another person, has the authority to stop the work if something is not being followed and correct it. So this should go without saying. Maybe we're making it more complicated by giving different titles and acronyms, but the point is you need someone responsible for following the protocols, making sure that happens, and the authority to fulfill that responsibility.
Absolutely. Okay, and there's another question that mentioned SSR, I think, as well. But okay, so we've got 12 minutes left. So we're going to try and get through as fast as we can. If we don't get through all of these today, we will definitely follow up with County Counsel, Dr. Mase, and make sure we can get these answered for you. So one question that relates to the last one, can the SSR person be a part of the construction crew itself as a whole?
Yes, as long as they have the authority to fulfill that role. Yeah.
Okay, great. I have a construction crew of Chinese speakers. Do you have written information to give them? For example, the health orders for Sonoma County.
I don't believe we have our materials translated into Chinese, but we can look into that.
Yeah, we are at the
Is that a request to translate the order and the Appendix A and B and whatnot?
I think it probably is. I think we can definitely do that. We work with a variety of local translators, so we can definitely work on that for sure.
Fantastic, thank you.
Let's see. Quite a few more coming in. Our front door front counter has been closed to the public for the last several weeks. We are a subcontractor to general contractors and serve essential services. We are considering opening our front door front counter to better serve our construction customers. Assuming we should ensure customers have a mask, or should we assume that we ensure customers have a mask before they enter our front door? Are there any other requirements or considerations as we consider opening the front door front counter?
That's a really good question and something that's not contemplated in this order. I think the assumption, even restaurants are closed. They can provide their services through, they can deliver the food, but you can't go into the restaurant. And I think that principle still applies here, but we'll need to push out some more specific guidance. For now, I would assume you can go out and do the construction work, but in terms of having an open storefront where people are coming in, I would hold off on that until there's more specific direction.
Yeah, and we can include that in the question follow-up as well, Jeff. Okay. So we answered this one about this. What enforcement of the revised order is going to happen? Can we expect inspections by any health department official or law enforcement?
I believe most enforcement is complaint driven. So I don't know if there are people patrolling, but you need to comply. And if someone asks for your protocol, you need to provide it. To law enforcement. So, but my understanding is that it's primarily complaint driven, and there might be some patrolling, but yeah, people need to comply.
Okay, great. And then how should we be handling on-site bathrooms?
As I mentioned during the presentation, Appendix B, as part of Appendix B, you're going to want a regular cleaning protocol that sanitizes any outhouses or bathrooms that want to be very thorough, so that it's a shared space. So the kind of shared space is going to need additional cleaning.
Great. And then while we have a few minutes, I see Dr. Mase is back. I have a couple of questions, Dr. Mase, that came up if you could help answer. We're getting a lot of inquiries about when the next health order is going to come out. Do you know if that will be today, or I know Jennifer mentioned it'll be into effect within a couple minutes of the next one?
Yeah, we're planning on getting it out today. We just want to make sure the FAQs and all the supporting documentation is out as well. And as Jennifer mentioned, it goes into effect, is it May 3rd, 12:01 a.m.?
May 4th, 12:01.
So it basically just goes back to back with the other order for when it goes into effect.
Okay, great. And then there was one question that we had a lot on, and I think it'd be important to address that we had a question about a hotel developer or a company that's working on hotel construction. And they're wondering if I can find the original question. Essentially, it's a 3-story hotel they're working on, and it's only at 20% occupancy for essential workers. They've been working on this renovation and this update and kind of trying to modify it. If they're able to wall off sections of a floor with no occupants, can they function as essential business and continue with the project July 1st like they had planned? I can send you more details afterwards, but it was kind of an interesting talk. I'm not an expert.
Yeah, I think that's addressed in the FAQs, so I would just stay tuned that because we specifically looked at when you have a building that's occupied, but there's an unoccupied portion of it, and we have language in there for what would have to happen to continue construction on the unoccupied part of a partially occupied building. So that's already in there. There's very specific guidance for what has to be in place to do that.
Okay, I think there was a follow-up question about what the nature of the air barrier needed to be. So we may need another FAQ with.
Yeah, we'll get back to the group and come up with the answer to the question.
Okay, fantastic. Let's see. Let's get through a few more of these so we have answers to those. If the business is considered essential and your office showroom is normally open to the public, is it okay to have our office showroom open now?
You know, like I said, the order doesn't address that. It addresses sort of the construction activity, and I think that we'll need to think about that and put out an FAQ because, or maybe even add language to the order because the idea is that, you know, we want to minimize interaction with the public. So that would be contrary to that goal, even though construction is allowed. So we'll have to follow up with that. And maybe we need to amend our order to specifically address it.
Okay, great questions though. And then another one with Dr. Mase, if you can answer this, is we had an inquiry about how long the next order coming out, that'll be effective 12/01, May 4th. Do we know how long that will last for?
Yeah, at this time, well, I'm going to wait until the order comes out. You know, I don't think I can address it until we have it out. I mean, Jennifer?
I
think it'll be out today.
Yeah.
Great, thank you. We anticipate using our building inspection staff to assist with enforcement. Are there any anticipated problems with this approach?
I'm sorry, I didn't hear the first part.
We anticipate using our building inspection staff to assist with enforcement of, you know, safety protocols and social distancing. Are there any anticipated problems with this approach?
Is this
like they're utilizing their business inspection staff for like the JSAS or the SSR, it sounds like.
I think it's within each business's discretion who they identify as the person responsible for making sure the protocols are all met and has the authority to stop the job if something needs to be remedied. I wasn't sure if they were referring to like city building inspectors or if these are people they have on their own staff. So I was a little confused there.
Yeah, it sounds like it's our building inspection staff. So, okay, to discretion. And then thank you, Jack, for the reminder. So there was one question, Dr. Mase. If the SSR is required to write a remediation plan when problems are identified?
I think that's not necessarily spelled out in Appendix B, but that's certainly something that a business, I mean, this is the Appendix A and B are a floor. To the extent something more needs to be explained, I mean, certainly the people responsible should be identified, their phone number should be in there. If there is, if the business wants to provide a protocol for sort of writing up problems that come up and how they were addressed, I think that is a very prudent practice, especially if you need to show that you are in compliance and that there aren't problems. I think another good practice that isn't necessarily required is, you know, should employees keep a copy of this of the protocol on their person? You know, when people are out in the field, how do you show that you're an essential business and that you have a social distancing protocol in place as required? Well, have it on you so that if you're approached by law enforcement, you can show them that you have it and you can show that you're complying. I think that just is a very good idea.
Okay, great. We have just a couple minutes left. Dr. Mase, so second part from that same question was, can you ask, will there be construction worker priority for testing? Now that it's an essential business and a lot will be kind of reopening, will they be a part of that priority testing moving forward, the expanded ones that you talked about in the past?
Yeah, well, the priority group was essential infrastructure workers. So I think the next group is all symptomatic persons. And so I think that's when people in this sector would get tested.
Okay.
Because essential infrastructure, we're talking about utilities, you know, the courts, sort of more public works projects is my interpretation of that. So very soon we're going to be testing widely, testing everybody who is symptomatic.
Okay, great. So those are kind of the main questions we have. A lot of them that are still pending. Let's see. Someone's asking where we can find Appendix A and B. I cannot find them on the Sonoma County website.
The current Appendix A is on the website. It's underneath the link to the current order.
I can try to look that up right now too.
So when the new order comes out, there will be both Appendix A and B. So Appendix B has not been publicized yet because the order hasn't been issued yet. So you're getting all a preview of what's in it.
Okay. And then if an employee becomes ill and could possibly have COVID-19, what must we require from them in order to allow them to return to work? Maybe Dr. Mase, you can answer this one.
Yeah, so basically anybody who's diagnosed with COVID needs to be isolated. The latest CDC guideline is to isolate them for 10 days. In our county, we're also deciding to do that across the board for any worker. So basically 10 days if you're asymptomatic, no symptoms. If you still have symptoms at the day 10, then for 3 additional days of being completely without fever lowering medication. So it could be longer than 10 days. But they'll need to isolate at home or in the alternate care site if they can't safely isolate at home during that time.
Great. Well, I think we're at 12:14, so we had a little bit of extension. We got a lot of questions answered. I know there is still some that we need some clarification on, so thank you so much for submitting those questions. We will make sure that we follow up after this. We'll work with Dr. Mase and County Counsel to get the answers that we need. So today the health order will be coming out, so please keep an eye out for that. I will also send a PDF of the webinar slides, just so you can kind of reference that as well. And then once we have the YouTube video, all the closed captioning done, we have it uploaded on the internet, we can definitely send that to you. And hopefully that'll be kind of the same time as the questions that we still have that need to be answered. We can send that to you guys all at once. But thank you so much for coming out today and just participating. I think we hit 112 at one point, which is fantastic. If you have any questions, I sent an email in the chat for EDB events at sonoma-county.org. So feel free to send questions. But I hope everyone's able to enjoy a little bit of the weekend. And if you have any other questions, just let us know. But have a great day. And thank you so much, Dr. Mase and Jennifer, for joining us today. We really appreciate it. I think we got some great questions answered.
Thank you.
Thanks, everyone. Bye.